A 36-year-old woman comes to the physician for fatigue, constipation, and a cough lasting several months. The patient has a temperature of 37 degrees Celsius, 98.6 degrees Fahrenheit, and has no history of smoking. Laboratory tests find a calcium level of 11.6 milligrams per deciliter. Which of the following additional findings is most likely also found in this patient? Choice A, consolidation at the left lower lobe of the lung. Choice B, centrally located growth in the lungs with intracellular bridges and keratin pearls. Choice C, granulomatous inflammation in hepatic tissue. Choice D, malignant cells with a glandular appearance. Or choice E, overgrowth of parathyroid tissue. I'll wait 5 seconds and answer the question. Now, as is often the case, I was a bit of a jerk and kept things a little bit vague here. You have a woman in her 30s here with a cough and hypercalcemia, which is likely what's causing her fatigue and constipation. Not a ton to go off of here, but a woman in this age range with hypercalcemia and a cough and seemingly few other notable systemic symptoms that you can see. If you look through the answer choices here, the one that points towards sarcoidosis, choice C, granulomatous inflammation in hepatic tissue, is the only answer choice that makes sense. Now, sarcoidosis is a systemic condition which causes granulomatous inflammation to occur across multiple organs. Most commonly, the lungs, that's the one you tend to hear about most in test questions, classically presenting as a bilateral hilar lymphadenopathy on chest x ray. I decided not to give that to you here because I thought that would be a little bit too easy. But one of the classic associations you really want to connect to sarcoidosis is the production of excess 1 alpha hydroxylase, which can lead to large amounts of activated vitamin D and therefore hypercalcemia, which of course will go back and cause negative feedback and cause a low PTH as well. This is something they really like testing with sarcoidosis for whatever reason. Again, 1 alpha hydroxylase production causes high amounts of vitamin D and therefore hypercalcemia. And sarcoidosis is often idiopathic. And one of the clues I guess I threw in here is the fact that this patient has no smoking association, which can help you differentiate it from other things such as cancer. So let's look at some of the other answer choices here. Choice A, consolidation at the left lower lobe of the lung. Obviously, this is referring to pneumonia, and you can mostly discount this because I gave you a patient that's afebrile here. It's not impossible for her to still have an infection. It's just one of those things that I threw into the question for a reason. You wouldn't pick infection in an afebrile patient unless you had just no other answer choices that make any good sense here. Choice B, centrally located growth in the lungs with intracellular bridges and keratin pearls. This is referring to a squamous cell carcinoma of the lung. I put this here because one of the paraneoplastic syndromes you really want to know, and many of you probably already know it, is that squamous cell carcinoma of the lung can also cause hypercalcemia because it can secrete PTHrP, which would similarly cause hypercalcemia like in this patient, and also low PTH, which I didn't give you in this question, but would also be the case in a sarcoidosis patient. However, this patient is young, she has no smoking history, and she really just doesn't have any systemic symptoms that would suggest malignancy. There's no like cachexia or anything like that. And especially in a young woman in ages probably in their 30s to 40s, sarcoidosis is pretty buzzy there, especially if they give you African American woman, right? I didn't give you African American here, but that's the classic patient, right? African American woman in her 30s and 40s. Choice D, malignant cells with a glandular appearance. This is referring to adenocarcinoma, which is the most common lung cancer found in non-smokers. But again, patient is young, no malignancy symptoms, and adenocarcinoma doesn't cause hypercalcemia typically. Now, malignancies can cause hypercalcemia if they metastasize to bone. But if I wanted to give you that, I probably would have told you about a lytic bone lesion or a fracture or something. Choice E, overgrowth of parathyroid tissue. Kind of a distractor here, just in case anybody doesn't really know what's going on here. I mean, parathyroid adenoma would obviously secrete a bunch of PTH and therefore would cause hypercalcemia, but you wouldn't have a cough with a parathyroid adenoma. I mean, it's not impossible. I mean, it's a viable answer technically, but it just feels like there's other things going on in this question where you wouldn't just go for a parathyroid adenoma. So bring it back. I mean, you just want to know some of the buzzing things to know about sarcoidosis. You want to know 30s to 40s African American woman is the standard typical patient. You want to know what causes granulomas in the lungs, especially, but it can cause granulomas all over the body. They've asked about that before. They could say granulomas in the liver, they could say granulomas in the thyroid, they could say granulomas in the heart, in the bone. It is a systemic disease. And of course, you want to know the classic presentation, bilateral hilar lymphadenopathy. You want to know it produces 1 alpha hydroxylase, which causes hypervitaminosis D, which causes hypercalcemia, and low PTH. I hope you found this video helpful. I'll see you in the next one.